effectively digitize treatment guidelines such as the national treatment guidelines in India to create a knowledge repository on which their AI engine can effectively help healthcare professionals deal with patients in the field to understand what their treatment and management should be based on those treatment guidelines. And when you consider the shortage of healthcare professionals in India, with over 50% of roles in primary care being unfilled, up to 70% in some cases, then this solution would be really one to address those gaps. We then have Optela. I think Crispin referred to them earlier. They are world leaders in using and analyzing radiology images to diagnose lung cancer. Crispin mentioned the fact that 85% of lung cancers are detected in stage 3 and 4, which effectively really limit treatment options, but also make it really expensive, and for certain strata in society today, that means they're in a very difficult position. So Optela work with the Oxford University Hospital. They recently won a £17.5 million grant as part of a consortium of 15 NHS trusts to effectively re-engineer the way cancer is treated and monitored in the UK. So they're part of the future of cancer care in the UK, and we hope that they will make an impact here in India as well. The next is Visualytics, who analyze OCT images, optical coherence tomography images, to diagnose glaucoma, diabetic retinopathy, and age-related macular degeneration. When you look at diabetes, you have about 75 million diabetes cases in India, of which a third have diabetic retinopathy, and half of those are undiagnosed. So when you consider that disease burden, a solution like Visualytics, which will allow handheld cameras in the field to take photographs, upload them to the cloud, and return a diagnosis in about 10 to 20 seconds, that seems like a pretty effective tool to address this disease burden. The next, just to say that Visualytics had earlier been introduced to Prime Minister May when they visited the UK as part of the launch of the Nexus. We then have tumor trace, from lung cancer, which Optela was covering, to cervical cancer, which also has a massive disease burden in India. When you consider that a quarter of all the cervical cancer deaths worldwide come from India, they are looking at providing a solution that is low cost, highly accurate, 95% accurate, using a combination of quantum mechanics and artificial intelligence. So highly innovative, and they're using that combination to achieve about 95% accuracy of diagnosing cervical cancer in the field using traditional pap smear slides. They've got a solution that both works at point of contact, but also at laboratories where you have a large sample of healthcare of slides which are unused. We then have, last but not the least, Your.MD, which again goes back to the primary care space. Their app-based solutions, the mobile-based solution, supports the identification of prevention, treatment, self-care, and management for patients, and aims to provide the likes of ASHA workers in the field with a mobile solution.